have children, and she also works full-time. And she needed a mammogram. She has a history of breast cancer in her family. And it took an entire year before she could get that mammogram at the University of Iowa hospitals. And so that was just done recently, and she has lesions in both breasts. The tumors in the one breast, they know are benign. The tumors in the other breast, they're watching because they aren't sure. I had another woman I ran into at the grocery store, working full-time in the deli, and she has a rare disorder where her spine has separated. And she was able to get into the clinic at the University of Iowa hospitals for 6 months. And when she finally did get in, she needed to be out of work for 6 weeks while she was, recuperating. And she had no way to support herself for those 6 weeks. So, I'm getting stories like that all the time anymore. And these are actually people who are currently on Iowa Care, so only illustrating how many shortcomings there are in that plan as well. And so to expand Medicaid, it's just the right thing for the state to do. It should have nothing to do with politics whatsoever. Nothing to do with it.
Second debate is still on the floor today. Are you actively involved in sharing those stories or lobbying or you just getting hands off way?
Well, I have had some conversations with Representative Montmeyer and with Representative Rogers and Heaton in the House. And I have opened our door and offered an opportunity for the subcommittees of both chambers to get together to at least make sure that we understand, the facts behind the Affordable Care Act and Medicaid expansion. And I say that because there has been so much misinformation out there about what can and cannot be in it, and even the misinformation for the last 3 or 4 years about the Affordable Care Act itself that have just been fabricated, wrong, you name it. So I just wanted to start by getting the two sides together to at least look at the facts. And then if we needed to, even get CMS on the phone with us, ask questions. And what I do know is we have been communicating mostly by email and by letter with CMS to, questions like, will enrollment caps be allowed in a waiver? And the answer was no. And that was in the governor's plan on an enrollment cap. Can you charge a premium? The answer was no. Not if you are earning less than 150% of federal poverty. Will not be approved. And there's a whole cadre of issues of that nature. So we know already that you can submit the plan and it most likely will be rejected. And please do not come back and say it has something to do with Washington hyper partisanship. It has nothing to do with that. It has to do with guidelines that we are already fully aware of, an opportunity, the greatest opportunity we have had in the history of this state or this nation to address public health, and why would we turn our back on it? It makes no sense. No rational sense.
CMS stands for?
Oh, Centers for Medicaid and Medicare and Medicaid Services. So we have been in contact with them, as well as the Medicaid enterprise here in Iowa, Jennifer Vermeer. We always try to communicate with the people in the know who have to implement this, who help write it, to make sure that we fully understand what needs to be in any kind of a waiver process and what that different plan would have to look like. So all I can tell you is what we've seen so far in the governor's plan. I cannot imagine that it will be approved because of all of the different components of it that fail to meet the test of what needs to be included for this group of our population.
Can you talk about, does it seem like Republicans are still on within their party because of Representative Heaton's reservation? They passed the bill.
Well, kudos to Representative Heaton. I mean, what he did, took a lot of courage, because what he did was the right thing to do for Iowans who are uninsured. And sometimes setting aside the partisanship to say, you know what, I was elected to do do what's right for the majority of Iowans. He did that yesterday, and I'm very proud of him for doing that. And I'm hoping he sticks to his guns and says, we can do better than this, and we have to do better than this. So my hat off to Representative Eaton for the courage.
Can you talk about the process and expected to pass out the House?
Well, obviously, they're going to adopt the governor's plan with an additional provision, I understand, on medical malpractice. And it will come back, and, you know, I'm going to floor manage it. I'm going to ask the body to fail to, not to concur with the House amendment, and the House has one more chance. They can recede from their amendment and pass Medicaid expansion as we did it, send it to the governor, and he can decide what to do with it, or they insist and we go to conference committee. What I do know is that there are many legislators and citizens who believe that this is such an important issue and such a fabulous opportunity that we have never had before, that we will stay as long as it takes to find a resolution.
So, conference committee?
Well, I am certainly hoping that the conference committee works and that we are able to convince our colleagues that the best thing for Iowa is to expand Medicaid. It's fiscally smart, it's morally right. What more can I say? It's those two things. And those two issues seldom come together in one issue. This one facing us today. But this kind of solution. Thank you for the questions. Anything else? There are others here that probably have more to say than I do, that know the face of this far better than I. But, you know, when you're the mom of a child with a disability, you get a lot more exposure to a lot of issues in your life. And I can tell you that the people I know are working hard every day and are playing by all the rules, and just aren't making it. And it's not because they're not trying.
Do you think that all these personal stories, if that doesn't dent the change the vote or change the minds of parts of the politics, what's going to take?
An election?
That's going to be a little too late.
You know, it would be, I know I was trying to be flip with you, but we're just not going to give up on this. I don't know where it's headed right now. I just know that we're not going to give up, and we will continue to try and work with our colleagues to set aside partisanship and philosophical, whatever, ideology, and look at the big picture. But thank